This episode of Fertile Talks is sponsored by ilmeds.co, an international mail order pharmacy specializing in fertility medications. If you're looking to save significantly on your fertility treatments without compromising on quality, ilmeds.co is an excellent choice, offering up to 80% of retail prices. And as a special offer to our listeners, use the code FT24 at checkout to receive a $50 discount on your order. For your convenience, you can find a link to their website in the episode show notes. Thank you, and let's get started. Welcome to Fertile Talks, the global podcast celebrating the diversity of fertility journeys. I'm your host, Dr. Yemi Famuyiwa. Whether you're just starting or simply curious, this is your safe space. In each episode, we will bring you expert insights, heartfelt personal stories, and the latest in reproductive health. Our goal is to break down barriers, tackle stigma, and provide support and hope. So whether you're in the Americas, Africa, or Asia, Fertile Talks is your companion on the path to parenthood. Thank you for tuning in and welcome to Fertile Talks. Good evening, everyone. This is Dr. Famuyiwa with another episode of Fertile Talks. So today I'm going to talk a little bit about supplement use, particularly in polycystic ovary syndrome, and I'll try to broaden it to some aspects of the broader fertility landscape, including some male data. And it'll be a two-part talk. So the first part I want to talk about is the use of some adaptogens, especially in PCO management. So in particular, there have been some supplements that patients have been using, and one of which is called ashwagandha. Ashwagandha is with Wisteria somnifera. And the other thing that some patients are using is called Rhodiola rosea, and that's receiving renewed attention in some landscapes. So these are plant-derived compounds that are believed to modulate the hypothalamic pituitary adrenal axis to reduce cortisol and also have some antioxidant effects. And they also claim to have some anti-inflammatory properties. So these are also pathways that could be affecting the pathophysiology of PCOS. So while their stress buffering effects, right, lowering cortisol, may be attractive to patients who are navigating metabolic burdens like PCOS, I think we should temper this emerging enthusiasm with a little bit of clinical prudence. So one is adaptogens, ashwagandha and rhodiola, they can influence your endocrine function in very unpredictable ways. For example, ashwagandha has been associated with altered thyroid hormone levels, which may worsen subclinical hypothyroidism, which is a condition that may be found in some PCO patients. It may be a comorbidity, right? So alterations between adaptogens can also interfere with medications used for PCO treatments, such as oral contraceptives, spironolactone, and even metformin. And this may modify the efficacy of those medications and hormonal profiles in very unpredicted ways, right? Unpredicted pathways. They may also have some gastrointestinal as well as liver risks, right? So usually they're well tolerated, but sometimes they have some side effects. And ashwagandha has been linked to diarrhea and in very rare cases, liver toxicity. Rhodiola, though, is more commonly associated with a dry mouth and dizziness and may pose risk to patients with hepatic or gastrointestinal vulnerabilities. So I think it just underscores the fact that you really need to be under the care of a physician or talk to your primary care doctor or your doctor before you start using these medications, right? And their effect in the pre-pregnancy window or pregnancy window has not been studied very well, right? So these are unvalidated botanical interventions that may conflict with the guidance being given by the leading reproductive and endocrine societies, right? So the 2023 International Guideline for PCO that came out specifically cautions against the use of non-evidence-based supplements during the preconception planning stage. Another thing that you need to be aware of is sometimes these medications can interact with psychotropic medications or metabolic therapies, right? So rhodiola, for instance, has been shown to potentiate your central nervous system stimulants. And this raises concern in patients who are managing anxiety, depression, or ADHD. Conditions which are seen in elevated prevalence in this particular population. So, in addition, there's been interaction with one of the main staples that we use to treat PCO, which is metformin. And it can interfere with metformin's ability to be insulin sensitizing, thereby making your metformin not as effective. So I would say they have been understudied. We need more studies. I think there's some data that in men, now I've talked about PCO in women, obviously, but in men, ashwagandha may be associated with improved fertility based on very small clinical studies and systemic reviews. And what they noticed was that some of these men had increased sperm concentration, semen volume, and sperm motility were seen in this men. I think that one should go about using these botanicals with extreme caution, especially in women who are dealing with PCO or who may have thyroid issues. I think you need to be extra careful. All right, so if this has been helpful, I need you to send me any comments, let me know, and I'll be happy to do the research for you. Till then, thank you for listening, and this is Dr. Famuyiwa. Please don't forget to share our podcast and like and subscribe. Thank you. Thank you for tuning in to Fertile Talks. We hope today's episode has provided you with valuable insights and support for your fertility journey. Remember, you are not alone. Now, if you have any questions or topics you'd like us to cover, please simply leave us a comment. And please don't forget to like, share, and subscribe with a friend. Your ratings, your shares, and your reviews are greatly appreciated and is going to help us serve more of our listening audience. Thank you once again. This is Dr. Famuyiwa.